we are again. Let's do some more learning today, okay? I know you had plans, you know, with your boo or whatever, got your hair on fleek, nails done. No, you trying to take an NCLEX. Nothing is more important than studying with Shelly B, not Cardi B. Here we go, let's go. Causes of a patient being in VFIB includes technically the H's and the T's. So let's roll with this mnemonic, shall we? Hypovolemia. Now you know what the hell that means. That means you have no volume. Now, when you have no blood pressure, you have no perfusion, when you have no volume in the body, no volume of blood or fluid in the body, you have no BP. And then you have no perfusion to the rest of the organs in your body, even the kidneys. We say no BP, no PP, you know. But hypovolemia may be the cause of this patient's VFIB. Who would that be? Post-ops, patients who have had surgery, GI bleeds, patients hemorrhaging. These two go together, H and H. Now, continue on, will you? Hypo or hyper electrolytes. Oh, you knew that. You knew when the K go up or the K go down, you can have a cardiac arrest. You knew that. You also know that when magnesium and calcium are low, you can also go into some VFIB. Hypoxia. Number one. Hold that. Look, y'all. Number one. What am I saying? I'm saying O2 deprivation is the number one reason for a patient to go into VFIB. So hypoxia. Here's one, hypothermia. This is usually a patient who's maybe drowned and that water was cold and they were under there for a bit, and you know the rules. A lot of patients that we do CPR on don't make it, but the one with the best survival rate is going to be the drowning victim because the water was so cold that it decreased their need for O2. It's really kind of cool. Keep on going, boo. You got a lot to learn. HYPOGLYCEMIA. Now, if you ever take a test in school or you're preparing for this NCLEX exam, don't miss this test question. Hypo is more deadlier than hyper. Oh, you can die from both, don't get it twisted. But with no sugar, no brain, boo. So hypoglycemia can lead to VFIB. You gotta know that. You gotta understand when that patient is hypoglycemic. And you know the classic symptoms, right? You know, where is that? Where that? Sweating. Oh, you know that, right? Boom, boom, classic. Sweating, shaking, and confused. They talking all kind of crazy like they got schizophrenia when they don't. You know, classic. The last H is a heart attack. Yeah, an MI, right? A heart attack will give you VFIB every time. But you gotta know something about that whole heart attack thing. You've gotta understand that it could be that the VFIB is coming during the heart attack, or this patient just had a heart attack on Monday and we're at Wednesday and a complication of a heart attack is also VFIB. Or there is damage and scar tissue to the heart from last year's heart attack and now they're going into some VFIB. Y'all got me? Let's do the second part, shall we? T. The H and T's of VFIB include toxins, tension pneumothorax, tamponade, you know, cardiac tamponade, thrombosis, you know, an MI or pulmonary embolism. Let me start here. You know, with toxins, this could be the kind that we prescribed, I'm a provider, or it could be the kind that the nurse gave you, or it could be the kind that you bought on 55th and Kinsman, you know, the illegal shit. It could be any medication or drug you could imagine, and it can cause a patient to go into VFIB. When it comes to that tension pneumothorax, the most important person I want you to think about is your motor vehicle accident. Now there's others, a gunshot wound, a stabbing to the chest because he cheated on her. Oh, I don't know where that came from, sorry. Sometimes personal life, you know. No, I mean, let's start over. A motor vehicle accident or a gunshot wound or a stabbing to the chest, all of that could give you like a pneumo, like a tension pneumothorax, hemothorax, whatever. But whatever it is, it can give the patient VFIB. Cardiac tamponade, you know, this is where the heart is filling up with blood and there's muffled heart sounds and pulses, paradoxes, and all this crap that you already know. This is pretty bad, you know that. Thrombosis is any one of the three, but the two are the ones that could give you VFIB. But I just want to be clear that you could have thrombosis with a stroke, which is a CVA, thrombosis with a heart attack, which is an MI, thrombosis with a clot in your lung, which is a pulmonary embolism. All three are technically clots, right? Thrombosis means clot. But the two that will give you VFIB, MI, and PE. Now I'm going to take a break. Now you ain't got no business asking what I'm about to do on my break. You take a break and I'll be back.